And take a look at this. We'll show you how fast this has happened since the first case in the U.S. was discovered way back on January 21st. We are now well over 330,000 cases. That is close to 1 in 1,000 Americans, and even that may be a low estimate. Nowhere is the crisis more evident than right here in New York City, where hospitals are overwhelmed. Our lead national correspondent, David Begnaud, was invited into one of them in Brooklyn.
A lot of our patients are presenting with severe respiratory distress, and it's a very acute. They were fine, and they had some cough, and then they weren't fine.
Dr. Joshua Rosenberg is a critical care doctor who also specializes in infectious diseases at Brooklyn Hospital Center.
Can you tell me of anybody in here right now who is one of those cases, like no underlying conditions, seemingly
This
healthy?
gentleman right here is a patient that really didn't have much underlying conditions, has developed severe respiratory failure as well as kidney damage from the virus, and is relatively young. That's about where it is right now.
How old is this gentleman?
This gentleman is, I believe, in his early 50s. They put him on a breathing tube and to save his life, and he's requiring pretty much 100% oxygen, and he's requiring a lot of air to help keep his lungs inflated.
It doesn't get any more critical than this.
It does not.
The majority of this hospital's patients are on Medicaid or Medicare. There were 10 other patients in the ICU, most of them black men, all on ventilators, unconscious, and isolated behind glass. They're all positive for coronavirus.
What do you gentlemen want people to know?
Well, I think people should take it seriously. I think, initially it was advertised as something that affected only older patients, and that's definitely not something that we're seeing. We're seeing a lot of younger, healthier patients, and they're coming in a very critical state.
We wanted to hear from nurses.
Give us your real-life assessment of what you're dealing with here.
It's very, very difficult. It's like something out of the Twilight Zone. And I don't think any of us going through it will ever be the same.
This is Kay. She asked us not to use her full name because she fears getting threats from patients' family members who are not allowed to visit.
I'd like a mask like yours. I'd like all of us to have masks like yours. And these white suits like you have, and I have on, what do I have on? What is this?
What is that?
What is this?
It looks like a garbage bag.
Yeah, this is a garbage bag. It is a garbage bag.
Kay was not the only staff member wearing a garbage bag over her scrubs. Many people use sanitizing wipes to clean themselves as they worked. This woman works as an endoscopy tech, but since elective procedures have been canceled in New York State, she's been helping out in the ICU. Many of her colleagues have fallen ill. It happened to her twice.
Did you have COVID?
I had the symptoms. I wasn't tested, but I had the symptoms. I had the chills, I had a headache. I didn't have the fever, but I had the chills, I had a headache, I had the shaking, I had the coughing, constant coughing, and the body ache, no appetite, no desire to eat, no taste in my mouth. And we went out, came back, and I was getting shortness of breath. And I went out again. So I just came back.
Wow.
Wednesday.
Wow.
Before we left, Dr. Rosenberg went into the room of the man in his 50s who suddenly needed his breathing tube changed. For that, Rosenberg put on a replaceable gown and ski goggles as he went in to join the team. They were successful.
This is serious. People are dying from this. Old people, young people, people are dying from this. It is lethal.
27 COVID patients have died so far at that Brooklyn hospital, and every time it happens, the body is loaded into the back of a tractor trailer, which is parked outside. You heard Nurse Kay ask for the face shield that I was wearing. She has it. I gave mine to her. We sanitized it and delivered it to her over the weekend. She will go to work better prepared today than she walked out on Friday having. CBS News has a very limited supply, which we are using to bring you stories like these. And her asking for that shield is a reminder that nurses here in New York City, and for that matter everywhere around the country, are asking for better protective equipment and more of it. Anthony.
Yeah, and they should get it, David, doing incredible work there in what Kay called the Twilight Zone. Thanks, David.